Hey everybody, this is Brett Andrew Simmons. I'm on the couch today with Professor Dan J. Sherman, who's here today. He's the founder and CEO of BrainFit Resorts. And he's here to tell us a little bit about his specialty and his background and what cognitive decline is all about and how it really affects the aging brain and some things that we should all be really aware of. And so I know we've had a few questions and comments in recent times on through BrainFit Resorts about, cognitive decline and why it's important. So he's here to enlighten us all on some key areas that we should really be thinking about. So thank you. Thanks for being here, Dan.
Thank you for having me.
You're very welcome.
A brief description of what I went through. At the end of my academic and clinical career, I was chief of obstetrics in a big hospital, taking care of about 8,000 deliveries per year. Throughout this time, I realized that I want to focus on something else. I want to focus on prevention rather than treatment of diseases. And as I obviously aged and was ready to retire, I decided that what's really important is our brain. And we do very little to take care of our brain. And this is about 3.5 years ago, where I decided to invest time in researching. I'm coming from a very evidence-based type of medicine, so I'm very keen about studies and showing effectiveness in treatments and stuff like this. Mm-hmm. And that's where I decided that if I have to pursue something in terms of prevention, is how to keep brain health. This is where the whole idea of BrainFit Resorts came into life. Mm-hmm. And obviously, we are close to retirement and we feel a little bit the signs of the aging process, not only on our body, also on our brain. Mm-hmm. Our speed of processing information, our memory, we oftentimes forget things. Names, where we put our keys, where our glasses, and so on. A lot of this is completely normal. However, oftentimes this can mean something, and this is where I think we can make a difference, where we can change the trajectory of declining brain powers, maintain them, and even prevent diseases such as dementia. Well, dementia, it's a tough question. And what does it look like? It's a terrible disease. It affects us mostly as we age. And slowly, we are forgetting who we are. This is a disease that robs us of all our memories, of our experiences, of our knowledge, and more importantly, of the people that we know. This is a disease where you experience death before your actual physical death. And we become completely different human beings, sometimes tormented with very few memories that are left from the past, but most of the time, the difficulties of coping with a new environment that we are not familiar with. And this means that what you have known yourself to be is not there anymore. So by the time dementia sets in, there is so much damage to our central nervous system that very little can be done. However, we have good data to suggest that if we make necessary changes in our life, in our 50s, 60s, and even 70s and 80s, we can prevent dementia from occurring. The natural cognitive decline addresses very, very specific cognitive domains or cognitive skills, especially memory, a little bit attention, and maybe the speed of processing is somewhat slowed down. But there are many cognitive skills that are improving with time.
Okay.
For example, the ability to analyze data and make decisions. Wisdom. Obviously, we gain experience, and we can use it down the road for many of these things where young people do not do as much because they don't have the experience behind them. However, the regular cognitive decline is something that does not interfere with our everyday life. Our everyday activities are usually maintained throughout. Interestingly enough, the research over the last 15 years has shown that the first signs, or let me put it in a different way, the first insults in our brain starts 15, even 20 years before we are facing with something like dementia. And this is an excellent window of opportunity to intervene. If we have 15 years and we already start at even midlife, mid-age, in our 50s, to think about brain health, we may prevent not only the cognitive decline, but more so dementia.
So Danny, okay, let's say I'm in my 60s, 70s, 80s. I'm aging, right? And so what you're saying is that there is a way that you can identify whether I might be at risk of developing one of these diseases. Is that right?
Yes, obviously. We can determine your risk of having dementia. Many people immediately, when they hear about dementia, think that there is a genetic tendency here. As a matter of fact, the only thing that is really genetic about dementia is inheriting the risk. But there are so many things beyond genetics. It's our lifestyle. There are many things in our medical history which are important. Whether we are obese or not, whether we have what we call type 2 diabetes, whether we have other heart problems, hypertension, and so on. So all these can increase our risk of having or developing dementia. But there are other things even more important than this, because many of these are what we call non-modifiable risk factors. For instance, age. Age is the number one risk factor for developing dementia.
You can't change being old, right?
Also, your level of education.
Right.
It's sometimes too late to go through education.
Sure.
Yes, but there is a caveat here. You can still educate yourself even as you age. So it's true that education is a non-modifiable risk factor. So if you have very low level of education, then you're starting from a lower point. But even as we age, and even our 60s and 70s, we can still learn and educate ourselves. And this is one of the things that we are trying to promote and show that the brain is what we call brain or neuroplasticity. The brain is malleable. You can change, and you can still have new connections, new neurons to make you possible to decline less. So we have taken all this and we have approached it in what we call the personalized medicine approach to, first of all, diagnosing your cognitive level. And secondly, and this is even more important than exactly know what is your cognitive level is identifying the risk factors. Many of these risk factors will just determine by observing what's your lifestyle. Other will be measurements, body measurements and stuff like this. And finally, we do some elaborate laboratory testing that will find if there are the forerunners of neurodegeneration, of cognitive decline that we may have to pay attention to. And we have packaged all this into some sort of evaluation that we do in BrainFit Resorts. We are targeting each and every one of your risk factors in order to minimize, slow down, and even prevent the cognitive decline.
You know, we've got customers that are coming from the US and the UK and Australia, and they're coming into Thailand, which I suppose geographically is central, but it's also a long way to travel. I mean, can't people do this thing at home?
Well, Theoretically, it can be done, but it's very, very difficult. First of all, you are very close to the environment that produces your lifestyle. I would call it even sometimes the toxic lifestyle that comes with cognitive decline. Mm-hmm. The whole idea is when you go to a clinic, you have half an hour, at best 1 hour with the doctor. He gives you a list of things to do. And then you go back home and you are faced again with the same problems. How do I change my behavior? So this is the advantage of doing it when you are remote from the environment that created this lifestyle that we are trying to improve, that we are trying to live in a more healthy way, is by, first of all, offering you an insight into what your previous life looked like. And secondly, this is offering us a chance to immediately change your behavior while you're still with us, and coaching you through the initial steps of how a change of behavior practically occurs. Not only that, in our resort you will meet people as yourself, having the same issues, the same problem. And I think the ability to share the experience, even the accountability that comes with it is a major advantage. And finally, I think that the resort, in a way, we are able to offer you the right stimuli of changing your behavior by offering you, for instance, a myriad of relaxation techniques, by offering you an insight into how you sleep, by offering you things that you can do while you exercise to make your exercise more enjoyable. So I can tell you, you have to lose weight. But how do you go about it and whatever? This requires a very intensive coaching with a group of people who are familiar with your particular problems, with your particular risks, and offering solutions that can be implemented once you are back home. So yes, the clinic generally works, but only for a short time and not more than this.
It's an interesting point because, being that we are here in Thailand, I suppose we get exposed to a myriad of different types of wellness, whether it be detox or whether it be yoga or meditation, retreats and those kind of things. But I suppose the thing with those businesses is that you go to a detox, you stay there for a week, you clean yourself out, and then 6 months later you're back. And I suppose at a business level it makes a lot of sense, but is it really treating the people that are actually coming to the detox to do what they're aiming to do? And I suppose to your point, if you don't change your environment, you don't change your behavior.
Exactly. So we did two things here. One, we focused and researched intensely what are the psychological strategies to make lifestyle changes that will stick with you, what we also refer to as sustainable lifestyle changes. So there is a learned experience from other people journeys of how to go about changing your behavior. And we can do this with the right coaching, again with some risk factor identification, and advocating for you ways about how to change your behavior. So and adopt a lifestyle that will stay with you. The other thing that we are trying to do here is not only having strategies that have proven efficacy in behavioral change, is also making sure that this will continue even beyond your stay in the resort. And this has made us decide on a completely different models than the detox centers that you have mentioned. So we are not relying on repeat customers. We actually want our customers to go on a new journey. So for us, the resort is just the beginning of a journey. But we'll follow you, and we have devised a long-term engagement platform, online most of it, where we'll coach you and monitor you throughout your journey for the months following your stay. And we're going to make sure that you are able to change your lifestyle. And we want our customers not to come back to us. We want our customers to do well once they are out there and they have learned what they need to do, and we'll coach them through this.
So, and that's really the key difference here, is that it's really not about just the foundational learnings that people get when they come to a resort. It's what happens when they go home, right? So you say that, you know, we'll stay, or you'll stay with people on that journey. I mean, what does that look like in practicality? How does that, I mean, it's delivered online?
It's delivered online.
Yep.
They will be able to use for some of these their mobile devices.
Okay.
Ideally iPads or whatever tablets they can do, or even a desktop. They will be able to join seminars. They will be able to join online lectures. They will be able to read the recent news or blogs that are relevant to cognitive wellness. They will be able to reach their coach and consult with him regarding certain issues that you're having, to monitor how do you really go about changing your lifestyle. So this is like combining sophisticated technology with something that everyone is using in his everyday life. And I'm sure it's going to be fun, because we are going also to offer you the same cognitive or brain games that we are using at the resort. You will be able to go on and use them at home. You will be able to find out if the food that you're eating is doing well. We'll be able even to monitor your sleep and how well you sleep. And sleep is a major determinant of brain health. So indeed, all this we'll be able to do on the online platform.
So for the people that are interested in this, I suppose the question that I'd be thinking is, well, is this for me? How do I know that, you know, this is the right thing for me?
I think practically this is for everyone. Everyone who is concerned about his brain health, who is, and this is why I usually don't like the word dementia prevention. I prefer the word cognitive wellness, because in the same way that we are taking good care of our physical body, our heart and lungs, our cardiorespiratory fitness, we should also be concerned with how to maintain our brain fitness. And this is why we call ourselves BrainFit, because after all, this is what we want people to be: fit with a brain, healthy brain, and living their lives to the fullest.
In terms of prevention, this is not treatment. So I mean, BrainFit Resorts is not a treatment center, right? Like, so people, you know, and I think we've fielded a lot of questions from people that, you know, have said to us, oh, you know, I've got a relative who's you know, had dementia or Alzheimer's for you know, a year or two, and, you know, can your treatments reverse their symptoms? And how does the program address that?
Well, unfortunately, we cannot help people who already have dementia. And dementia has very strict criteria nowadays, and it's mostly the inability to cope with everyday activities, like feeding yourself or taking care of yourself, finding your address, knowing the people around you and everything. But before that, and even people with what we call mild cognitive impairment, also in the medical literature it's called MCI, mild cognitive impairment, we can still help, because this is a trajectory. And since we have such a huge window of opportunity, we can intervene and make a difference. So it's like you get a warning sign. Let's say you have a coronary artery disease. Not necessarily your arteries are clogged, but if you're already showing signs, you can improve your health by doing the right exercises and so on. So the same thing goes for the brain. I mean, yes, we can identify some problems and some declines or deficits, but we can still maintain our brain and make sure that it connects internally and externally with the environment, with the people around it and everything. So there is a lot here that can be done.
Danny, thanks so much for spending some time on the couch today. Really appreciate your insights. There's some fantastic information to be found through BrainFit Resorts, and we hope we've been able to enlighten all of you with some of the information around BrainFit Resorts, and we invite everybody who may have some concerns or want to find out more about BrainFit Resorts and the program that's available, visit www.brainfitresorts.com. You can also find us on Facebook and on YouTube using the links in the description. Take care.